Haijalishi nimepitia maisha gani, nimepitia hali gani. Mimi kama mwanaume naweza kuwa nimeshindwa mahali, nimeshindwa hata kutenda kazi ambayo Mungu amekuita katika familia, katika kanisa, lakini siku ya leo Mungu anataka kukuinua. Mungu anataka kuonekana katika maisha yako. Ambia tu Mungu kwamba nataka unitembelee katika session ambayo inakuja. Mungu nionekanie, Mungu niwezeshe, kwa sababu wewe ni Mungu. Hakuna mwingine kama wewe, Mfalme Yesu. Tunakutukuza, tunakuinua. Asante kwa sababu unaweza yote. Katika jina la Yesu Kristo nimeomba na kuamini. Amen. Pigia Yesu makofi mazuri. Let us also appreciate the praise team. Asante sana praise team kwa kazi mzuri. Tupigie praise makofi. Alafu tukae na nikaribishe speaker, presider wa next speaker to take up from there. Let's appreciate Pastor Mbugwa as he comes. Tupigie pastor makofi mazuri. Asante.
Let's appreciate our president as he gets to sit. Good afternoon, Quakermen. Quakermen, hi. Very well. Mine is very brief. I'm here to introduce our next speaker, who is Daktari Mutuma Chofri. He is a consultant, pathologist, cancer researcher, and CEO the Zambezi Hospital. And he's going to talk to us about men's health and wellness. He's married to one wife, and God has blessed him with 2 children. So may you put your hands together as I invite him to come forward as we pray together. Thank you. My name's Fred Imbukwa Shivoko Mwana wa Roots. Let's pray. Father in heaven, we thank you, we bless you because of your servant. As he speaks to us, Lord, may you use him to be a vessel of great value to us. It is in Jesus' name we do pray. Amen.
Good evening. I think I've been introduced. My name is Dr. Geoffrey Mutuma. I'm a consultant clinical pathologist, and I'm a cancer researcher. I've done cancer research in Cambridge over 25 years. And I run an hospital called the Zambezi Hospital. And I'd like to present mainly on issues of men or the common diseases which we have currently. My presentation will be almost, let us say, 45 minutes, if you can make it, to concentrate up to that time. During my presentation, don't mind if you sleep. After that, I'll allow some few questions, if it's possible. If just write your question. I think my friend has said that now the car which is given here is mine. Maybe somebody who knows how to drive. Somebody who can trust. Just put it where you want to put it. That's my car. Yes, yes. And no cut out, nothing. So I think you allow me to be here so that I can start my presentation, so that I save in terms of time. I'll present by slides. If you have issues of seeing the slide, let me know, so that I can make them a big bigger. Everybody can see there. Hello? Everybody can see there. Can somebody assist to bring me this one so that I can be able to move without a problem? Asante sana, thank you very much. God bless you. Right, I think that's my name. Don't worry about my qualifications. I'm a consultant clinical pathologist, what I've said. I'm the CEO of the Zambezi Hospital, and I've been doing research for quite a long time. And as the way my friend introduced me, that I'm married to one wife. Before I used to have 2 boys, but I was reminded that I have men. My first son is 23 years. My second son is 25 years. Na nikafika hapo. Mine is one-stop cancer information center. Anything you need to know about cancer, you consult me. Anything you need to know about cancer, from awareness to risk reduction, and that's, I'll talk to them in details today, because we know that cancer is a major problem in this country and to continue being a major problem. I'll talk about routine screening, and today we are doing screening for all men there. I think you have been announced, it's good to be screened. I know men are very tough, they don't like to be screened, but it's good to be screened today. We are giving you a very good discount. We intended to screen all men, and I'll talk about what you need to screen. As a man, what is very important to be screened first is your blood pressure. If you are here, make sure that you check your blood pressure, and even after a year, you keep on checking your blood pressure. I'll talk about later. The second thing which is very important is check your blood sugar. Very important, because those are 2 diseases which are very common in this country, very common in men, and we are seeing the men having these diseases. One of the most important things I have to tell you that hypertension, that's blood pressure, and blood sugar have no pain. Most of the patients, when they come to see the doctors, they have complications. We have seen so many people who have got blood pressure. They have been having blood pressure for a long time, and they die because of high blood pressure, and they have not seen a doctor. And that's why I do recommend, after 25 years, you make sure that you check your blood pressure all the time, because we know, and I'll show you the statistics which you have, that most men have got high blood pressure and they don't know, and they continue having a problem, and they come to us when they are very, very advanced. So I normally recommend routine screening. I'll talk about that. I talk about early diagnosis, especially for cancer, diabetes, and hypertension, and then also early treatment, because most of the reason why we go down, why most of our Kenyans actually do very badly, is because they go to hospital very late, especially men. And I've seen that most of the men, when they come to the hospital, they bring the wife to the hospital, but not man coming to the hospital. I've heard several times where a man comes and tells me, look at this person. Hello? Look at this person, the wife now. He believes that the wife is one sick. And when I check the man does not leave the hospital, is admitted. So as you take your wives to hospital, which is very important, make sure that at least you are checked. Because we are concerned, us as doctors, because we are losing so many people because of not going for routine checkup and early treatment, and we need to reduce the palliative care. Palliative care is mainly when we talk about cancers. 90% of the patients who have got cancer today, they come for palliative care, not for treatment. And main reason is because, 1, they are not aware. Second, people are not aware of risk factors. Third, they don't go for routine screening. Diagnosis is a nightmare. So by the time they have diagnosis, the cancer has advanced very much, and they're coming for late treatment. So most of our patients up to this time in this country, we come for palliative care. Palliative care is wait and see when we are just trying to treat. One of the most important things we have to know is that cancer is treatable and curable, irrespective of the stage. Right, I think this is a bit of my qualifications where I've worked before, and that's not very important for today. I have a diploma in cancer prevention. I've worked in several places. I've qualified several places. I want to talk about common men's issue. I'll go to details about them later. One is heart attacks. Heart attacks are very common in men. And most men, actually, men die due to heart attack than any other cause of death. That is a common cause of death in men. It is because of high level of cholesterol, especially when you have got hypertension. People who have got hypertension, they always have very high level of cholesterol. I'll talk about cholesterol, about lipids. It's very important to make sure that you check about cholesterol. Heart attack, what is heart attack? In English, we normally call it ischemic heart attack. It's where somebody falls down and dies without any problem or any disease. The heart just stops by itself. It stops by itself because it has got so much cholesterol, so much lipids, so much fat. And that's why I normally like to give my talk after lunch, Because after my talk, you know whatever you ate today, it is not the right food. Hello? Whatever you ate today, after my talk, you know that whatever you ate today is not the right food. And for men, I tell them one thing. Whatever you eat outside your home is wrong food. Whatever you can write your notes. Yeah, because it's good. Whatever you eat outside your home is wrong food. And that's why I normally recommend that you know your diet outcome to talk about that. So, heart attacks are very common. Cancers are very common. I'll go to details about cancer because it's one of the problems. I remember when I was starting my cancer research in Cambridge in 1998, cancer was not an issue in this country. And when I used to say that cancer will kill more people than all disease combined by 2025, I thought 2025 is very far. And up to this time, everybody sitting in this audience knows that cancer is a problem in this country. Cancer is actually will be a killer number one. And that's why we are saying that in the next 10 years, most of our children who are 20 years and before and below, most of them will have cancers. As we are lucky, we are survived, but we need to take care of ourselves, and that's why screening is very important, and I'll go to this about that. I don't want to talk about diabetes. Diabetes is so common. I'm sure everybody knows that in every family there is somebody with diabetes. In every village, in your church, there are people with diabetes. And I remember when I was in school, my teachers cheated me that diabetes starts after 40. But what we have seen recently is that most of the people who have got diabetes, they're actually less than 40, 30 years, 25 years. And that's why we find that diabetes is very common nowadays. And I go to details. You know exactly why diabetes is common in this country and why. And this I say without a caution. In case you don't have it, don't worry, it's coming. In case you have it, just be friendly to diabetes. I normally tell people that you be friendly to your disease so that you live together for a long time. If you are not friendly to the disease, one person will go and not the disease. When you become friendly to the disease, you may stay quietly and comfortably, and you can stay for many years without a problem. But when you are not friendly to that disease, and I go to this about one person will go, and I don't know who will be that. So diabetes is very important. Hypertension, I'll talk about it. Hypertension, talk about it. Very common disease nowadays. I don't want to tell people that cancer, hypertension, and diabetes is disease which if you don't have them, they will come. If you have them, just be friendly to them. You stay comfortable with them, and you stay for a long time without a problem. Depression. I don't want to talk about depression in men. I know men are depressed. I don't know what depresses them. I know here, there are people, they are here, lakini wameshatoka hapa toko. Hello? Rudi hapa toko. Toko pamoja. They are having many problems. Where is my children, the school fees? Where are they? Where is so-and-so, my farm? Many have got a lot of problem. I don't want to talk about depression today. Depression is brought by stress. Stress is the center of everything. Stress is brought by anxiety. Stress is brought by fear. We have got so much fear in our life, and we fear everything which is brought by the devil himself. So depression is not good. So many men are depressed because of so much stress. And I normally have a topic on management of stress. And one of the most important things to manage a stress is know that you are stressed. And you say that you are stressed. Second, you know what is stressing me and what can I do to remove the stress. Sometimes the stress is almost impossible to remove. You just know how to live with it, because after that, you will start having depression, which is not good, especially when men have depression. Erectile dysfunction is a major problem in men, and I'll go to details about that, and I've got a solution for that. For those who have got erectile dysfunction, it's a major problem, especially nowadays. I'm not worried when men have got erectile dysfunction after 60 or 70 years or 80 years, but I'm worried when a man is 50 years and below. And this is a problem. I normally have it every day. Like I can tell you today, I normally give some products which I'll talk about today, which can sort erectile dysfunction. And I found that is actually the products I sell so much, because most men below 50 years, they have a problem of their erection and they cannot maintain their erection for a long time. Remember, without erection, you cannot reproduce. You cannot make a woman to conceive. And in fact, I'm concerned nowadays because so many men, now wanaume wanakufa kijeshi. Most men, they've got that problem, and the person who brings this man to me is the wife. Ananiambia, hii mzee afanye kazi. The worst is when a man, he does not want to come and see me, and of course I've talked about this for a long time, and people know me because I've assisted so many men. It's when it's brought by the mother. Of course, be taught by the wife. And this is a problem, and in case you have it, don't worry. We have a solution for this, which has been giving us a bit of problem of recently. I'll not talk about COVID, and this what we do ourselves. We promote healthy living and modification lifestyle. That's what we promote. And I'll go to details about that. And that we teach about eat nutritious food. From today, just know that you are sick and you'll be sick because of food. Whatever you are taking by your mouth, not from today, from next year. This year, just eat the way you had planned. Tuko pamoja. Next year. This year, because sometimes when I give my talk, people they have a problem on what to eat. Because I was telling somebody that I went to America to be trained about cancer control. That's 2000. And when I went there, they trained me about carrots, about pawpaw, about sukuma wiki, about indania, about pilipili oil. You can imagine a old doctor going to America and be told such rubbish. I thought these guys are joking with me. And that's why you find today, and that's why when I came back to Kenya, I'm talking about 24 years ago, when I came back to Kenya, I knew in Kenya we have a problem, and we will have a problem because of nutrition. And that's where we have gone wrong about nutrition. And that's why when I'm giving my talks, I normally tell people that just take your time. Take your time. Don't go and change your diet overnight. Take your time to change your diet because diet is a major problem. Now, the third one is the most important thing. The third one, the most important thing, is nutritional food supplements. I know there are so many people who have talked out to you about food supplements. What I normally advise people is anybody selling supplements, just listen to him and take, if you can afford, just buy it and don't ask what they will do in your body. Just see what they will do in your body. I'm sure most of you, they know that the king is sick. Did somebody read news about that? And they said, remember, if you want to be trained well as a doctor, you go to London. You go to London. If any training in this world is best done in London. And when the king became sick, he said he does not want drunks. Remember, he has got the best doctors trained in this world. He said he does not want drunks. He wants food supplements because they are very important. We know what we do, and I don't normally recommend food supplement to everybody if you want to live long time. If you are not sick, you can still take food supplement because food supplement, I've talked about it, are carrots, sukuma wiki, ginger, put in capsule. And that's where we have gone wrong because of not eating the balance, the correct food. I think I've talked about that. That's my qualification, not very important for today. I've worked in Cameroon from 1998 up to this time. That's not a very short time. I've written a book, and this book, it got finished long time, and I've not written another one, so I don't want to talk about it. We normally do cancer walks to create awareness. And this I normally do every February. I'll be doing it since 2015 up to this time. I'll be doing cancer walk, and I will not. I think I'll just show some few features about cancer walk. But before I go to there, let me talk about the key issues. Because after every cancer walk, we have got key issues which we normally address. We normally address awareness risk reduction. I'll go to details about that. To be aware about cancer, about diabetes and hypertension. We have got a lot of myths, misinformation, and misunderstanding. There are so many people who have got so much stories which are not true. Those are called myths. Myths or mythology. Those are things which actually are not real. But people think, and they think that they know. And then misinformation. We have got so much misinformation, and I've had so many patients who have been misinformed, not by other people, but even by the doctors have been misinformed and misunderstanding. Mainly, I've seen there are so many people who want to trust Dr. Google. Everything you Google. And normally when you Google, I've seen this quite common. When a patient is brought to my hospital, especially by the daughters, the daughter is very busy Googling. When you tell the patient this is what's happening with you, the young man or the young daughter tells you, no, doctor, you know the Google says this. Now, when you think you know more than the doctor through the Google, the only thing I can do to you, I charge you more. Control and prevention, very important. I'll talk about that. Reduction of the gap, I also talk about that. And when I mean the reduction of skills gap, I mean the skills gap of the doctors. Because one of the things why we as patients, we go wrong is because, or we do badly in our disease, because the doctors give us the wrong information. Of course, I don't blame them, because these diseases came recently. Cancer, diabetes, hypertension was not the disease for Africans. These are diseases which have come recently, but these are diseases which will affect most of us, if not all of us. And that's why there's skills gap, especially in cancer, where I specialize in, is that I find that there are so many patients who actually they are misinformed. They have stayed for 2 years before they come to start treatment for cancer. And the patient knew that he had cancer, but he has been, it's because of the skills gap of the doctors, which I don't blame them, because I remember during my training, cancer was not an issue, and we were not trained about cancer. In fact, it was a topic for one day. Just mention there's somebody got cancer. But nowadays, this is the main disease which you have. So even if you have been skills gap, we need to close it for our doctors. About the cancer walk, that's normally what we do. I think it's very clear. And this, I just want to mention that we normally do cancer walks all over the country. I think the first round, I normally do it in February. I did Machakos, I did Ebu, I did Meru, I did Mombasa, and Kwale. That's the first round in February. The second round, I'm doing it in Nakuru, Narok, County, Nyeri, and Kilifi. I'll still come to your county, don't worry. It's just I'm planning, and that's normally what we do. After the cancer work, we normally have awareness, health talks, and information which I'll give you today. Screening, I normally recommend, and I've talked about it, about common diseases, cancers, hypertension, and also diabetes, because what we want to do is actually to make a diagnosis, be able to stage your cancer, treat your cancer, and then we do palliative care. In cancer treatment, which I would like to talk about, because I know most of you are leaders. And you'll come across so many people, or you have already come with so many people with cancer. And the only thing I normally advise people is that the most important thing about cancer is treatment. And the first treatment of cancer is food. The first treatment of cancer is diet. Because cancer, the most risk factor of cancer is diet. So the first treatment of cancer is diet. And that's why I normally tell people, when you come to me with cancer, I start talking about carrots, about sukuma wikis, about ginger, about thyme, which is very important for diet and nutrition. The other thing which is very important is immune boosting. I know most of the doctors, they'll go straight to surgery, chemotherapy, and radiotherapy, and that's not the right thing. Because until you eat well, the cancer will have a problem in you. Now, we normally do cancer screening, routine checkup, which we are doing today. First, I used to do a lot of screening. But later I discovered that Kenyans they don't want to know the disease. Wengine wanasema, wacha ikae sitaki kujua, it's good to be screened. I've talked about this. And today we are screening. I know you're above 300 here, or 250 around there. And I'm sure if I get 10% of you screened, I'll be good to go. Because whenever I go, the highest I get is only less than 10% be screened. And normally my screening is normally very cheap and very friendly. And normally I talk to the families. I know there are so many families, and I've seen so many families which have got prostate cancer. You find the grandfather died because of prostate cancer. The dad died because of prostate cancer, and the son is having prostate cancer. Those are called familial cancer clustering. Very common. You find that most of the families, they've got either prostate, breast, colon, or ovary cancers. Those are cancers which run in families, and there's a gene which actually one family can have that gene. And if that family has got that gene, it means that if the women have got breast cancer, the men will have prostate cancer. And that's why now and I'm doing a cancer research on this to check if there's a familial clustering in Kenya, real familial clustering, but this has been proved somewhere else. I like talking to community, and I like talking to the church. And that's why when I was told that there's a church meeting here, I said, that is the right place to take. Why? Because it's in the church where sick people come. And as leaders in the church, you need to, what do I need to do with this person who has got cancer? What do I need to do with this person with diabetes, this person with hypertension, this person with arthritis? What do I need to do with this person? I know prayers are good and miracles are there. And the miracles happen every day. But it's always very important to make sure that whenever you have a patient, it's always good to make sure that at least that patient, you take care of him spiritually and also medically. It's very important when you're a church leader. I don't want to talk what to do every Saturdays. Because me as a doctor, when we meet on Saturdays for burial, that is a failure as a doctor. Because we have seen that so many of our people, they are going. And when you go to every burial today in Kenya, it's either this person died because of cancer, this person died because of diabetes, this person died because of hypertension, or we don't know why he died. But mainly, it's because of this disease. And that's why I normally like to talk about the churches, about what can you do. Because prevention is better than cure. And if you say screening for the diseases is expensive, just try the disease. And you see how expensive it is. Schools, this is very important. Like now, the cancer work, the people come for my cancer work is only learners, school-going children. Because I want them to grow knowing that cancer will be their major problem. I know most of us, when we are growing up, we are being taught about diabetes. No, we are being taught about kwashiorkor, marasmus, diarrhea, TB, and the rest. That was our time. Our children are learners who are in school today. Their major problem will be cancer, diabetes, and hypertension. Most of them, by the time they are 40 years, they will have those diseases. And that's why I like them to grow knowing that this is common for them, and that I think I've got permission from the Ministry of Education to be able to partner with them. Of course, I deal with other organizations which are also very, 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 very important. Now, I would like to talk about this problem, which I know most men have. And when you have it, once I advise men, I know there are so many myths and misunderstandings. There are so many challenges. First, impotence and sterility is very common. First, infertility in Kenya is rising up, especially in men. And I've seen this. And that's why that impotence is called erectile dysfunction, refers to trouble getting or maintaining an erection. That is a major problem in men. Especially the way I've said men who are below 50 years. And when you got that problem, this can be difficult or impossible to have intercourse. And this actually, remember, one of the major factors or the major thing as in men, it is to reproduce. And that's what God gave us, to reproduce, to bring other people in this world. And that's why we find that when you are impotent, there's a problem, and this is a problem which actually becoming very common. Now, I know people who have got diabetes and people who have got hypertension, there are people, they become impotent because of the disease. They become impotent because of the drugs which they take. And that's why normally, when you've got that problem, I've got a solution which I'll be able to show you, so that if you've got that problem as a man, we can be able to sort it for you today. Because I do believe, talk is very cheap. I believe in action. So when I come here, I normally come with a solution so that you don't ask, what did that doctor say and where will I get that doctor? I'll still give you my number and also give you my card. But my card I give to people above 65 years. If you are below 65 years, I don't give you my card. I'll give it to you. So One of the major problems is that there's infertility, refers to inability to produce or release sperm for men. This is a problem which was there for men and for a long time, actually. It was better before, but we have seen a big change for the last 5 years. The infertility and also impotence in men, it has raised very high. We don't know what the problem is, but it's a problem which we need to check what we can do as doctors, and I'll give you an advice what we can do. And then that's something very important. We normally check testosterone. That's hormone for men. And this actually, and this hormone is what makes a man to be a man. And of course, you know that when you start having testosterone, is when a man is a boy is at around 16 years when it changes the voice and also changes his structure. And I'll talk about that later as I go on. I'm going backwards. Right. That was a curtain raiser. Let us start now. What are the major problems we have in Kenya? We have cancer, diabetes, hypertension. Those are the diseases which we have. These are serious diseases. If you have to ask God a disease to have, ask number 6, arthritis. That one cannot kill you. Okay? The rest of the diseases are normally very dangerous. Now, let us come to real issues. 15% of people have got high blood sugar and they don't know. 15%, except here. Okay? Yeah, you are okay. Okay? So 50%, it's only 86% who are normal. If your blood sugar is above 6.5, it doesn't matter when you have eaten, you need to check about yourself. 16% of people have got high blood pressure. This is in Kenya. 16%. And they don't know because they have not checked for it. And that's why it's normally very, very, very important to check your blood pressure all the time. Body fat. I don't want to talk this about men because only 23 of us, we are normal. If your weight is above 70 kilograms as a man, know that you are already overweight. 70 kilograms. I think we don't have a weighing machine today, but it's always good. I wish it's there. Just step on it. And in case you don't have it, it doesn't matter your height, it doesn't matter your genetics. It's very important to know that actually body fat is not very good. Cancer thrives on 2 things. Cancer feeder number 1, it is sugar. So when we are taking sugar, you just know that you are feeding cancer cells. Cancer feeder number 2, it is milk. Questions later. The cancer feeder number 1, it is sugar. Cancer feeder number 2, it is milk. Cancer feeder number 3, it is fat. Hello? I'm not hearing. Questions will be later. There will be time for questions, don't worry. And remember, you are talking to a researcher. So the facts I'm telling you, they are not cast on stone. But, you know, people ask me, Daktari, why is cancer so common? Why is diabetes so common nowadays? It is because of what you do commonly. Because I know every family nowadays takes sugar in the morning. Every family in the morning, they take sugar with milk. And the better, the higher the content of milk, the better the tea. Now, the better for cancer. And I know, like pastors, but pastors, when you go to visit your Christians, when they give you that tea, please take it. But go and sort yourself later. Are we together? Because it is so bad as a pastor, you come to see me na kupikia chai, unaniambia mimi sikunywagi maziwa ama na kunywa chai turungi, true tea. That's the best tea. And that's why you find that cancer, diabetes is very common. I'll go to details after you ask questions. I know there are people who don't believe what I'm saying. This is what is not good. I'll not talk about that. In case when you are touching your body, there is something you are touching. Don't touch now. Just know that if you don't have diabetes, it's coming. Because it is extra weight which attracts diabetes It is extra weight which attracts hypertension. If you reduce 10 kilograms of your weight today, the blood pressure will go away. Okay? So that's normally very important. I don't want to go to other details about that. What are the risks of cancer? The first thing is that there's no cause of cancer. There's no single cause of cancer. What we have is just risk factors. People ask me, Daktari, what is the cause of cancer? There's no cause of cancer. And that's why everybody has got equal chance of having cancer. Don't say that you are safe. Just God loves you. Because risk factor number 1 is diet. Risk factor number 2 is diet. Risk factor number 3 is diet. Risk factor number 4, if you have got wrong diet, the way you have eaten today, not yesterday, today, obesity, physical inactivity, you are supposed to do exercise every day. How many people did exercise today? What did you do, my friend? You did what? Morning run. Very good. Excellent. Who else did an exercise? Yes, what did you do? I feel as if I'm preaching to the choir. These guys, they have done what's supposed to be done. We need a commercial break now. Can you remove your telephones? I want to see the exercise. Hakuna telephone hapa? Wacha. Okay. We need to have a commercial break now. It is good to do exercise every morning, to run out. Very important to run out every morning. But I want to show you exercise we should be doing every day in your bedroom. Every day. Every person by WHO, we are supposed to do 150 minutes per week. It means 30 minutes every day. And I want to show something which you'll be doing in your room. You don't need to get out. You just do the exercise in your room. So pick out your telephone, smartphone. Ukiwa uko na kadude usitoe. Okay? Mulika mwisi usitoe. Touch telephone. Alafu unaenda kwa YouTube. I want to show everybody. Everybody, including backbenchers. Hello? Including who? Remove your telephone. This one is important to make sure that everybody knows about it. Because this is the only thing I want you to know, because it will take away your diabetes, it will take away your high blood pressure, it will reduce the chance of getting cancer. You are going to the YouTube, just type T25. Type T for tot, 25. T25. We are having a commercial break. Wale wamelala waamuke. T25. Umepika hapo? T25. T for T, T for tot. T25. Umefika hapo boss? T25. It's called, yeah, that one. The green one. Just tick anything which is green. Cardiac, yes. Let me see this one. Let it make noise. Workout, yes. Cardio workout. T25. There are many of them. Get the one which is green. The one which is green. The one which is green. Go back. Just that one. See if it. Let it make noise. T25. This one. Excellent. This one. Yes. This one. That's very nice. Let it make noise. Just keep it. Not this one. But this is also good. That's also good. T25. Any exercise about T25, let it make a bit of noise. My friend has got the correct one. Yeah, T25. Nani hajafika? Cardio workout. cardio workout. Workout. There are many of them, N of them. This one, that one, this one, that one. Just keep it. Some people have got it. Yeah, that's okay. Just take that one. T25. Let it make noise. We are on a commercial break. Yours is not coming out nicely. T25. Yes. Skip that one. Skip that one. There's some people have got it right. This one. That one. Yeah. Yes. Nanya Chapata. Not that one. Not that one. Yeah, that's okay. That's okay. That's okay. That's okay. That's okay. T25, that's okay. That's not the one. Just go back. Just go back. T25. The correct one is not coming to you. Just try that one. Right. Right. Let it make a bit of noise. I want to see who has not got the correct one. Yes, yes, that's the correct one. That's the correct one. Yes. Uchapata, oh, it's not coming on. T25. Hiyo kuna shida hiyo. Yeah, that one. That one. Yeah. Yes, this one. That's the correct one. That's the correct. T25 workout. C25. There is the best one. Yeah, that one. That's the correct one. Just do that one. It's coming. It's coming. This one is not coming. Yes, that one. That one. That one. That one. That one. Right. So, where are we now? We are in number 5. Let us make noise. Keep on making noise. Let us make noise. Because that is what is very important in you. You need to start doing, and that exercise I normally advise men. You do it in the morning or evening, and you do it in your bedroom. Before you go to shower, just start. And when you start, there's a disclaimer. When you start, don't start today, tomorrow after church. You do it 5 minutes only, or 1 minute only. If you do 25 minutes for the first day, your heart will stop. Nastaki maneno. Are we together? You do it slowly by slowly. You get used to that exercise. After 1 month, you can do 25 minutes and you have no problem. That's very important. Physical activity. Most of us, we are sick because we are not physically active. Most of us, we go to work. And once you go to work, you go to sit down, and that's not very good. Normally, I don't want to talk about alcohol and smoking, especially in church. But how many people don't smoke here? Hello? How many people don't smoke here? How many people don't smoke here? Nyote amukusema ukweli. There is what we call passive smoking. Cancer of the lung is very common nowadays in Kenya. When I started my research in Kemri, I said cancer of the lungs is not there in Kenya. Because it was not there 30 years ago. There was no cancer lung in Kenya. Very rare. Nowadays, cancer of the lung is number 7 in men and number 12 in women. Meaning that it will be the commonest cancer in Kenya in the next 20 years. You can take that to the bank. Cancer of the lung. Because everybody in Kenya now smokes. And we are talking about passive smoking. That is when you are in Nairobi, we are parked cars there. There is something they remove behind there called smoke. That's the most dangerous smoke, especially if you live in Nairobi. Is the rate of cancer is rising. Cancer of the lung because of smoking is rising because of factories and because of smoking, passive smoking. Cancer of the lung because of smoking is the commonest lung in the world. It's the commonest cancer in the world. It was not there in Kenya before because we had few cars. Now we have got cars, even we got expressway because the cars are so many underground. Unapitia huko juu because cars are so many. We have got thicker highway because cars are so many. That's why cancer of the lung becoming very common in Kenya. It will continue becoming common. It will be the commonest killer in Kenya in the next 10 years to come. Now, other risk factor for cancers is chronic infection. I don't talk about that. Hormones, I don't talk about that in men. Because cancer of the prostate is common in men because they have got hormone for men. Hormone for men is what causes cancer for the prostate. So if you're a man and you've got testosterone, means that you are candidate for cancer of the prostate. That's why all men at the age of 70, they have got at least a cancer of the prostate. Most men die with cancer of the prostate, not of cancer of the prostate, because of hormone for men, testosterone. Testosterone is a hormone for men which comes from the testes. And that's why it's very important as a man, just pass through my place here, do PSA to check how is your prostate now before we go to other complications. Now, pesticides, genetic inheritance, I don't want to talk about it. Pesticides and plastics. I don't know if you've gone along any river when there were floods. You see so many plastics at the banks because they were washed in the river during the rains. Plastics are they are cancer risk factors, and the other thing is actually genetic inheritance. I've talked about it. Most of the cancers are idiopathic. You have no risk factor, but you already have cancer. Cancers are idiopathic. That's why everybody has got equal chance of developing cancer, because cancers are idiopathic. We don't know what this causes. Idiopathic, it means that the patient is pathetic when the doctor is idiot, because he cannot explain nothing. Other risk factors for the cancer: constipation, acidity. If you've got constipation, some people, unakula chakula kidogo, tumbo inajaa gas. Gas, that constipation, acidity, less sleep, this major. If you don't sleep for 8 hours, non-stop. I know men, we wake up in the morning at night to go and urinate. That's a problem I want to sort to any man who has got that problem. After 50 years, most men wake up at night to go to pass urine. Some men pass even 2 times, 3 times. But when you go to sleep, 8 hours, kukinyesha, unaamuka kukuja kukunyesha na kusikia. That's your sleep. Sio unalala na unasikia. Unalala na unasikia. Hiyo sio kulala. You are sleeping and you are hearing. That is half asleep, and that's why we have got a lot of cancers, a lot of hypertension. Chronic emotional stress, I will not talk about that. It's a major one. Finance, divorce, death, those are quite common. Which cancers are common in Kenya? I want to tackle this, and maybe for 2 minutes. I'll tackle for men. Women I'll not tackle. Oh, but every man has got a woman in that, is it? At least, I was told by statistics, every man has got at least 9 women in his heart. I mean your sister, your mom, and your aunt. Hello? That's what I mean. Cancer of the breast, very common in women because of use of contraceptive pills. Family planning, commonest. Cervix, very common. Esophagus, common in women. And stomach, endometrium, all that is common in women. Cancers in male. That's why I want to concentrate. The common cancer of men is cancer of the prostate. In every 12 men, 1 man will have cancer of the prostate. That's statistics in Kenya. And that's why whenever I go, when men are met, I normally advise them, be checked your PSA to check how your prostate is. It's very important. all men who come to see me with cancer of the prostate, they come with stage 4. Cancer is not painful. You can forget what I've said. The only thing you need to take home today, just know that cancer is not painful. Because most people, they tell me, Daktari, me, I've got cancer, I've no pain. In fact, I've got a major problem, especially in men. When I check, I tell them you've got cancer of the prostate. And they say that, Daktari, I'm not having cancer of the prostate because I'm not having any pain. No cancer is painful at all. I know you ask questions later, I'll explain. And that's why it's very important to be screened for cancer of the prostate. If you're a man and you're above 40 years, if you're below 40 years, enjoy your life. You cannot have cancer of the prostate. After 40 years, if you're 70 years and above, the risk of having cancer of the prostate is so high. You need to be checked every month. And the checking, we just use blood, which we are just doing it here. I hope they have enough for everybody. And that's enough for you. Because this cancer is very common in Kenya and is rising up. There's no control. And every man, provided you are a man, you have got a risk of developing cancer of the prostate. And that's why I've said in every 12 men in Kenya, 1 man will have cancer of the prostate. Cancer esophagus, very common for those who come from Kericho, Murang'a, Limuru, and Meru. Large bowel. Very common nowadays. In case you have got gas, or when you go to long call, you take 1 or 2 days before you go to long call, and when you go to long call, it's so hard. It means that you have a problem in your colon, stomach. Stomach cancer is so common in men. I know today there are so many men who say that, me, I don't eat sukuma wiki. Ama nimeambiwa na daktari nisikule sukuma wiki. I should not eat chilies, that is pepper. I should not eat beans. I should not eat kachubali, onions, because when I eat, I've got problem up here. That's why cancer of the stomach is very common. Because when you have that problem, when you got peptic ulcer or ulcer in the stomach, after 5 years, 10 years, that converts to cancer. And that's why it's very common, because people have got that disease. And when you avoid those foods, you may not have pain. But remember, the cancer or the wound is developing from a clean wound to progress into cancer of the stomach. And that's why it's very important. If you've got H. pylori, please make sure that you are treated and cured of H. pylori, because the risk factor number 1 of cancer of the stomach. In case you take Omes, don't take Omes for a long time. Be checked and be treated so that you don't take Omes. If you take antacids, Actor, don't take for a long time. That's acidity in the stomach, which causes cancer of the lung, of the stomach. Cancer of the lung is number 6 now in Kenya. I'll put it number 1. Very soon, cancer of the lung will be number 1, because everybody smokes. The only way to avoid developing cancer of the lung is to stop breathing. Cancer of the mouth. Cancer of the mouth, pancreas, the rest of the cancers, I will not talk to them very much about it. These cancers all over the world. Cancer of the lung is number 1 in men. Prostate, number 2. Colorectal, number 3. Stomach, and this I've explained why they are common, and this all over the world, not in Kenya. In fact, nowadays we are saying that the cancers we find in Africa, they are just drop in the ocean. Because in Europe, cancer is so common. In America, cancer is so common. In fact, in every 4 people in America, 1 will have cancer. That's how common it is. It is because cancer is a disease of the rich. The more rich you become, the more you attract cancer. Remember, when we were very poor in Kenya, there was no cancer. You know, I told people that I started taking tea when I went to university. It's when I started taking tea. We were taking uji with nothing. How it was going down, I don't know. And remember, our children, we love them so much. We started taking coffee and the tea, madasi, bread every morning, na Blue Band. Maziwa. When there's no milk in the home, there's a problem. When there is no sugar in Kenya, cancer of the lung, prostate, stomach, women, cancer of the breast is commonest, and they follow like that, and the rest of the cancer of the prostate, this cancer in men. Very common, I've talked about it. Prostate has no function in your body. It can be removed and live a normal life. It can be removed and you reproduce. Most men, they think if you remove your prostate, you become impotent. There's nothing like that. Prostate has no function in the body at all. That's how it develops. When a man has got backache, a woman having a backache is normal for me. But when a man has got backache, it's about 50 years. The only thing I check is cancer of the prostate. Because cancer of the prostate, mainly, it moves to the back very fast. And it spreads the rest parts of the body. And then I'll go through the rest of cancers. This cancer of esophagus, I've said, is very common in Meru. It's common in Karatina, in Limuru, in Kericho, in Bomet. Where they grow coffee and the tea, cancer of the esophagus is very common. Because it's very cold, so they take tea very hot. So when you say, I want food hot, I know wanaume, bibi akileta chakula ambao sio moto iko maneno. Sawa sawa. Usikule ikiwa imepoa sana, lakini the hot food is not good. The risk factor of cancer of esophagus in places where it is very cold. They take it when it's hot and they burn their stomach, and that's why it's very common in those areas I've talked about. Cancer of the stomach, there's no screening. It just, wait. Cancer of the lymph node, cancer of the colon, very common nowadays. It is number 4 in men and number 5 in women. What are the facts about cancers? There are so many of them. Every part of the body can have cancer. The nails can have cancer. The hair can have cancer. The skin can have cancer. The eyes, everywhere can have cancer. Cancer is causing a lot of deaths all over the world nowadays. In fact, most of the countries is killer number 2 or number 1. In Kenya now, cancer is killer number 3. Very soon, it will be killer number 1. In 2025, this is my statement which I made in Cambridge when I was studying my cancer research. By 2025, cancer will be causing more deaths than all diseases combined in Kenya. That's what I said. And I thought 2025 is too long. But I'm knowing now every family, every now and then people have got cancer. That's we need to know. The reason is that we are not aware. We are not aware about the risk factors, and we are not taking the right steps. And I'm surprised up to this time, we have not started getting the right stages of cancer. 70% of all deaths, cancer is common in developed countries. But 70% of deaths occurs in developed countries. Why? Because of poor access of cancer treatment. Tobacco causes 22% of the cancer deaths. 20% are caused by infections. I talk about human papillomavirus, hepatitis B, H. pylori, cancer of the stomach, and then HIV, which has gone down. 30% of cancers can be prevented by diet and health, life, physical activity, which I've shown you. So it's good to practice very good diet, which I'll go to details about it now. And then cancer of the brain, very common. Why is cancer of the brain very common nowadays? Why is cancer of the brain very common nowadays? Backbenchers. I will need an answer from backbenchers. Why is cancer of the brain very common? Yes? Not stress. Stress brings hypertension and diabetes. Huh? Depression, no. Not depression. Why is the cancer of the brain become very common? Especially in women. It's very common. Cancer of the brain is common because of what everybody has today. Anybody without a telephone here? Hello? Anybody without a telephone here? I mean here, mahali tuko, na ukiwa umewacha kwa charging, bado uko nayo. Okay, cancer of the brain becoming very common. That's why most of the times you find that cancer is become very common for us. What are the risk factors of, and when I talk about cancer, remember put diabetes, hypertension there. Rest, I've talked about it. Exercise, I've shown you. Now, let me come to diet now. Because diet is where you'll be surprised. These are ice cream. I know in your church, there's a guy who is outside selling ice cream to the children. Ice cream, that's diabetes mellitus, which we are calling to our children. I will not go to diabetes, but I need to cover it for some people. When you are feeling you are angry all the time, you feast it, you urinate quite frequently, you are losing weight without anything, and you've got sexual issues, you are thirsty all the time, those are the signs of diabetes. I would not like to cover diabetes very much. These are complications of diabetes. I'm sure you have heard people in your church who have been amputated because of diabetes. Diabetes is not painful, it's like cancer. But it normally destroys the most important organs. The diabetes normally destroys the brain, destroys the kidney. That's why we have got so many people now on dialysis. I remember I was telling somebody, when I was being trained, there was no dialysis in Kenya. The machine was there for demonstration only. Now, in every county, even sub-county, we have got dialysis machine because of diabetes, because of hypertension, because they normally destroy the most important organs in the body. Now, let me talk about this. That one I will not talk about. Let me talk about this. The heart. I've said most of the men are dying because of heart attack. And normally what happens in men, and I want, is when the cholesterol blocks those vessels supplying the heart muscle. When it blocks, the heart stops immediately. It's called heart attack. Why does it do like that? When you take the goat meat, the red meat has got a lot of cholesterol. When you are chomaring the meat, there's something which comes down in Havana cha kwa makaa. That's pure cholesterol. When you take it in your mouth, it goes into your stomach, it goes into your arteries, it blocks the arteries. It is called cholesterol, very dangerous in men. When you are eating red meat, just remind yourself, there's a doctor who told me red meat is not good. When you eat meat, men, eat meat which can fill your palm, not your hand. Your palm is this one. This is your palm. That one. This is the amount of meat you should eat. Twice in a week, not every day. Twice in a week, not every day. And that's why you find that heart attacks, ischemic heart attack was not there in Kenya at all, because we are not eating a lot of meat. Remember, long time, those who are of my time, we used to eat meat on market day, or you go to ant, and you come with a dick, you have killed. It was rare to eat meat. Nowadays, you pass here, even in the smallest market here. In the morning, there are 2 cows. Simawekwa. In the evening, unaenda, imeisha. Imeenda wapi? The meat for an animal is food for an animal, not for a human being. Tuko mamoja. Nyama ya mnyama ni nyama ya mnyama. Sisi ndio tujifanya wajuaji. Remember when God created Adam and Eve? He put them in garden. There were fruits. See, Adam alikula fruit. Let us learn from alikula fruit. Is when Abraham came, the animals started coming. And as Kenyan, we are meat eaters. We eat too much meat. That's why heart attacks are very common. You have heard so many men. A man has never been sick at all. But he dies and he dies and he dies. He has never been sick, even a single day. It's because of heart attack, because of too too much cholesterol, which is very common in men. I've seen men even who are 25 years and they have high levels of cholesterol, and that normally what happens. It's good to be checked your cholesterol as a man all the time, especially if you like meat. Exercise I've talked about. Now, what is the color of rice? I thought that's a simple question. The color of rice. Rangi ya mchele ni gani? Wrong. Color ya ngano ni gani? Brown. Tuko pamoja. The color of rice is brown. That's what it is. The color of wheat, it is brown. How many people grow wheat? There must be people. The color of wheat is brown. What do we do because we are so clever? What do we do because we are so clever? The color of rice is brown. That's why when you have diabetes, tunakwambia ukule mchele ya brown. Ukale ya brown, because that's where nutrition is. Hello? Sinisimamisha hapo. Hello? Nisimamishe hapo. Hello? Nisimamishe. The color of rice is brown. From today, just know that there's one single doctor told me the color of rice. I normally tell people, when I come to your home, I'll eat what you give me. Mukienda kutembelea watu wale wengine, unakula ile umepatiwa. Usipeleke maneno kutoka kesho. Umwambie daktari ameniambia, and I've said, and I'll repeat again. Any food you eat outside your home is wrong food. Tuko pamoja. That one I need to repeat for men. Because that is what causing our men to be sick. Because of food, because of food, because of food, because of food. Rice, it is brown. Wheat is brown. What we do, because we are so clever, you remove the outer part of wheat. You give it to cows. It's called wheat bran. Or rice bran. The outer, the most nutritious part of the wheat, we give it to animals. Even the maize, the same thing. We remove the good part of maize and we give it to animals. Others do and do modokoi. They remove the good part of the maize, they're left with the white. The whiter it is, the sweeter it is, the better it is for cancer and diabetes. Diabetes is common because we have left the traditional African food, we have gone to Western type of food. I will not talk about that. People like number one, not number two. You are what you eat. This is the right food. This is the food we eat which is wrong. Okay? The right food is this one. Brown ugali, ile ya wimbi, ile ya mtama. That's the correct ugali you eat. With greens. Millet with greens. Sorghum with greens. Wimbi with greens. That's the best diet. Questions later. Question later. This is the worst food you can ever eat. The food which, this is the best food you need to eat. We perish because of lack of. That's what I'm giving you. And I tell people, when I give you my knowledge, whatever you do with it is up to you. When I give you my knowledge, this is the best food you can ever eat. In case you have got diabetes, eat kidheri 1 full month. And if you still have diabetes, come to me. Kidheri 1 full month. It is the best food. Sio kidheri nyama. And when kidheri you eat a lot with a lot of maize. Instead you have constipation or gas, just eat a lot of maize. And that will go, and it's not, fruits are very important, especially colored fruit. And the fruits are only 2. Hey, nimeharibu. Fruits are only 2. Fruits are only 2. Pawpaw and avocado. Don't ask me what about. What about? Fruits from next year. This year you can eat any. From today, just know that banana is not a fruit. Banana is not a fruit. We have a lot of diabetes, a lot of cancer, places where they eat banana. Those who come from Kisii, they know that. Those who come from Uganda, diabetes is rampant in Uganda because of matoke. All what they eat, it is sugar. And you know banana is sugar, it tastes like sugar. And it's white. Banana is good if you eat the cover. Brown bread, whenever you take the brown bread. This is a food you don't eat, white ugali. I don't know how it was, but I know the brown ugali, when it was served somewhere here, it was left. The white ilimalizika mbele. Tuko pamoja? Hello? Hello? The white ugali ilimalizika, alafu brown ugali hakuna mtu anaangalia. In the next meeting, just go and take the brown ugali. In fact, in the kiongozi wa hapa, aseme next meeting for men, hakuna white ugali. Tutakula ya wimbi peke yake. Tuko pamoja? I'm finishing now. Rice, white rice. Remember, I ate the diet you ate today. Sinipatiwa chakula. And the guy was so nice. Daktari, kuja kule. Sasa ningemwambiaje chikulangi. Nilikula lakini I know I've eaten wrongly. I will sort myself at home. And that's why I normally advise, especially those who are pastors, don't go. The family has spent 1 full week waiting for the pastor to come. Alafu unafika na wanasema sikulangi white ugali, sikulangi chai. As a pastor, African socialism, unakula ile umepatiwa na unakula unamaliza. Alafu unajua hii nimekosa. Ukienda nyumbani, you sort yourself. I'll tell you, don't worry. Okay? Very important. So, and chapati. I know the people who are of my age. Chapati was for Christmas. Ikipita Christmas hii, ngoja ile ingine. I can see some people are worried, are surprised. Some ages, yeah, chapati was for Christmas day only. Nowadays, it's every day. Don't ask why cancer is very common nowadays, why diabetes is very common because of this. Chipo. I don't know where it came from. They're called French fries. Even if the potato is grown in Kiambu, they're still called French fries. They are very dangerous. Don't take them. Nyama choma. The more choma it is, the more worse it is to yourself. The sweeter it is, the more worse it is to yourself. Our children, we are giving them chips. We love them so much because they are 1 or 2 or 3. In fact, me, I have only 2. I wish I had many. So, but Kenya's children are eating to death. And that's why most of my cancer works and cancer awareness are focusing in children. Because they will have a problem. And because what we give them, I don't give them detox. Because this, if you tell a child, and remember parents, when a child does well, unamnunulia chips. Ukiwa unapeleka shule, unapelia mahali munakula chips. I've seen what parents do. That's very dangerous because that's not good. Our children are eating to death. Remember, this long time, not recent. It's not our country. Nyama choma. Kenya's new silent killer, nyama choma. This was 2010, actually. 14 years ago. Kenya's new silent killer. So whenever you eat any red meat, know that smoking. We have agreed that everybody smokes. Okay. I've finished now. What's the way forward? We are not getting this from our diet. Weight management, very important. Fix your diet. Fix your diet. So that when you eat wrongly, you are aware that I've eaten wrongly. Like I'm acutely aware that I've eaten wrongly. Which means that I have to see what to do. Use supplements. And that's what I talked about. And I would like to demonstrate a few of the supplements which are here. And we have them here. What are the supplements? Supplements is addition. When you have eaten wrongly, you go and clean yourself. You go and detoxify. When you are eating the mafuta, ile ilikuwa kwa mboga leo, have you seen ile mboga tumekula leo? That's why I like to come after lunch. Because if I give the talk before lunch, kutakuwa na maneno. The top, umeshaona hiyo sufuria? Hapa juu. Hello? Ilikuwa na nini hapa juu? We have seen what the fat does. So, supplements are normally very important. And I would like to show some of them, few of them, before I have questions. And we have them here. I normally say that I don't like talks. Talk is very cheap. It's easy to tell you about all these things. But you have to practice. Now, as men, when you go to your home after this seminar, don't cause chaos at home. Usiende useme kutoka leo hii nyumba yangu. Utakuwa na shida. Let's teach them a bit. You know, as men, especially men of my age, you know, when we are found in the kitchen by your dad, it means beating. I know men nowadays, the young men now, they go to kitchen. Men of my age, being found in the kitchen by your dad is real beating. But the teaching is different. It's good as a man to know what to eat. Because remember, diet and the food is the worst thing which you can. I want to have all of them so that I can be able to demonstrate what I mean by supplementation. That's what I say. After a year, I'll sort myself. I'll sort myself by diet. Like leo nimekula nyama, at least 3-4 days, sitakula nyama. We have supplements for immune boosting. Very important. We are sick because our immunity is not good. Why is our immunity not good? It is not good because of eating sugar. Cancer thrives when your immunity goes down. And because we are giving our cells, our bodies, the better the food, the sweeter the food, the better it is for cancer. Cancer are cells in the body which they like good food. They like meat. They like white ugali, white rice. They like chapati and rice. In fact, when people have got cancer, if somebody has got cancer today and you stop eating carbohydrates, rice, chapati, bread, the cancer cells will die without treatment. It is called ketogenic diet. The cancers will die. But because you have got cancer and you continue taking sugar, you continue taking milk, you continue taking chapati and bread, they start growing in red meat. And that's why it's very important to use supplementation. There's one woman's health, and I'll go to details about it. The link between medicine and supplementation. I've talked about somebody who's very senior in this world, not in Kenya, in this world. And they said he does not want medicine. Have you asked yourself why doctors don't like taking drugs? Like me, to take drug, lazima unilazimishe. The Panadol you take, I better have headache than to take Panadol. Because drugs are dangerous. Drugs, they are approved. The board which approves drugs is called Drugs and the Poisoners Board. See, that's the name. It's drugs and what? Drugs are poisonous. Just know that. When we are taking drug, most of the, of course I know there are people with diabetes and hypertension, and as a doctor I give people drugs. But I always tell you, take a supplement to remove that toxins which I'm giving you. As a doctor, and most of the doctors who are here, they know this. And that's why most of the doctors, when they are sick, our take kwenda hospitali. In fact, as a doctor, when I take the drug, I think about the poison in it more than the effect on me. I know you have seen so many people, diabetes, hypertension, and they're taking the drugs, and they start, their ears goes bad and bad and bad and bad. They're still taking drugs. And because what happens, it's because, and that's why I say that it's always very important to take a supplement. And supplement, it is actually the link between medicine and supplement. Before, and no doctor will support a supplement because we are not taught this in school. Imagine going to tell a doctor about a supplement. Like me, believe it or not, I've been in university learning for more than 10 years. Not working, learning. And you come to tell me there's something called supplement, which I did not learn in school. Will I believe in you? And because we are not taught that, it's only me, I normally do them because I was trained in the US. And all these supplements, believe it or not, all of them come from US. All of them. Because they know and they knew where they went wrong. They know and they knew where they went wrong. And they know. Like this supplement is called Yunzi. There's nothing in this supplement. It's just Sukuma Wiki put here. There's nothing else. Sukuma Wiki, kales. They take the active ingredient of kales or Sukuma Wiki, they put it here. That's why they are very expensive. They are not cheap. Because the technology used to create a capsule, taking one capsule of this called Yunzi is like taking 1 kilogram of Sukuma Wiki. 1 kilogram, one capsule. And that's why when a patient has got cancer and I give these products, they do very well. In fact, and this is a testimony I have to give. There are some patients, when I've given these supplements, when I ring them and they pick the telephone, I get surprised. Have you rang somebody and when he picks the telephone, you get surprised? What do you think? Why do I get surprised? Yes? Positive? Because I expect that patient to have gone. Because with cancers, in fact, there's a patient who has got cancer and they asked him, Daktari, how long will you like me, do you think I'll live? I told him maximum 2 months, cancer of the pancreas. I gave him these things, but he takes them religiously. In fact, I've still to see him because I rang him last time and he picked the telephone. Cancer of the pancreas, when you have it, maximum time to live, 1 month, cancer of the pancreas. But because of these products, and that's why I normally tell them, it's normally very good, you take them. When you've got arthritis, if you've got arthritis, and arthritis for men starts at 40. It becomes worse at 70. Arthritis is a sure thing of coming in your life. No exception, because it's a degenerative disease. And these products, once you take them within 6 months for arthritis, that arthritis will go. Those are walking with sticks. You put your stick down. And if you don't put your stick down, come to me, I'll refund your money. When I give you the drugs in the chemist, do you know you buy drugs in chemist? Chemist means chemical. Chemicals are not good in our bodies. I know we like them, and people don't like. So we have got a solution for it. This is the best for men. It's called X-Power Coffee. The what? Pesa badai. This X copy for power, this you take it is coffee, take it for 3 days, you become normal man. If you got issues in bed, very good for men. Except when you got diabetes and hypertension and you're taking drugs for more than 3 years, you need to take at least for 2 weeks to become okay. But for men below 40 years, only issues in bed, you take it. In fact, for men below 50 years with no disease, 2 days is enough for you. Okay? Very, very, very useful products. This one is peptic ulcer. Sikulangi hii, ita probio 3, sikulangi hii, sikuli hii, unakunywa hii, unakuwa sawa. This is for cholesterol. I've shown the man who has got issues of cholesterol. And all the patients, or if you take drugs for hypertension, you are given 2 drugs. One is for hypertension or high blood pressure. The other one is to reduce the cholesterol. Because if it remains with you, it will bring you problem in the heart. It's called atorvastatin. I'm sure people on hypertension drugs, they know that very well. It reduces. This is a natural product. It will reduce your cholesterol. It has no poison at all. This is coffee. This is coffee. Supplementation and medicine. This one, you boil water, you put. It has sugar, it has milk, it has coffee or tea. It has everything. And that's why I normally tell people nowadays, it's very important to make sure that at least you know. This is for coffee. Coffee. For coffee. Why you take coffee? Why do you take coffee? Coffee. Everybody takes tea. Am I right? Yeah. This better coffee. And this the coffee which has got some treatment in it. It's good for people with hypertension, people with diabetes, instead of using the normal coffee, the normal tea, the normal cocoa, the normal chocolate. This normally is coffee for that. This one is this for men. There are 2 products for men supplement. These they go together. And there are many. And in case this is for diabetes, those are called diabetes. This is for hypertension. And this is called Detox Life. It removes toxins from your body. You take this, it will remove toxins from your body. The toxins which you have taken. The smoke you have smoked without smoking. Okay? It will take away the link between medicine and supplementation. In case you need more information, you talk to my people. They will explain more. In case you need more information, I will always be able to show you what to do. Detoxification. Removing the toxins from your body. We get sick because of the toxins. We get diabetes because of toxins. And what the 5 toxins? Take the best detoxifier is water. Hello? The best detoxifier is water. The way the water washes our clothes is the way it washes our body. So take a lot of water. Okay? Water is very important in life and even in our souls. In your church, do you baptize with water? You don't? Hello? Do you baptize with water? Okay? That's another chapter for another day. Water is very important. Okay? Vegetables. Banana is not a fruit. Nimesema hiyo. Cabbage is garbage. Cabbage is garbage. You eat what is green. What is green is good for your health. What is green? The greener it is, the better for you. The green is something, it is used, this thing of the teachers used to beat me because of not spelling chlorophyll. Okay? Photosynthesis, what is green is better for you. The greener the vegetable, the better for you. Okay? And then fruits, I've said there are only 2. Pawpaw and avocado. The rest are the rest. Okay? And then the rest of the things, fix your diet. Make sure that your weight is 70. Ikifika 80, that's a red flag. Okay? Weight management is very important. Avoid refined food all the time and avoid eating at night. Hello? Meni mko? Nimesema namna gani backbenchers? Stop eating at night. Why do we eat? Why do we eat? Why do we eat? To get the energy, is it? Nataka tusikizane, pole pole. Why do we eat? To get the energy, is it? Tupate nguvu. Tukubaliane kwanza. Tunakula kwa nini? Kwa sababu ya njaa. Na ukisikia njaa una nguvu. Kwa hivyo unakula ndio upate. Alafu unakula na unaenda kulala. Hiyo nguvu ni ya kufanya kazi gani? What is a supplementation? What is supplementation? Is additional, which is health, is good for the sick. And that's why you find that when I was talking about supplementation, there are some for those who are sick. And when I'm talking about supplementation, and I know it takes me away a bit because I've known. You know, when I was taught about food supplementation, of the value of food, or the value of nutrition in the US, 2000, I did believe on them. Kama vile mumekataa. Kuna watu wamekataa vile nimesema. Hata mimi nilikataa. Don't worry about that. We'll come to that. Nilikataa. Kwa nini? Because whatever they are telling me is what we are eating in Kenya. And remember, when you are rich, and everybody here is rich, there is no poor man here. No single poor man here, and I cannot see one. Diseases is for the rich. Cancer, diabetes, hypertension is common in men because men in Kenya, they are richer than before. Every family, almost every family in Kenya can afford a cup of tea in the morning and bread. Most of the families, 90% of the families. 40 years ago, it was opposite. Only 10% could afford a cup of tea in the morning. But the equation now has changed. That's why we have got so many diseases, and that's why we need to supplement. Whenever somebody talks about supplementation to you, listen to them. I've finished. Questions. But before you ask questions, let me answer some questions. Total body cancer screening, there's nothing like that. There are some people, Daktari, I want you to do cancer screening in all my body. There's nothing like that. I'll check cancer of the prostate alone. Like today, we can check all the men here cancer of the prostate. I'll check cancer of the stomach alone. I'll check cancer of the breast alone. There is no total body cancer screening. There's nothing like that. Second, na serikali inafanya nini? Read number 5. Health and wellness is personal responsibility. Health and wellness is personal responsibility. For men, it's your personal responsibility, not for the government. We are sick because the skuma wiki we are eating today, it has been spread so many chemicals. The milk we took today, si tumekunywa chai leo? That milk ilitoka wapi? Kwa ng'ombe ambao ni a grade. Hiyo ng'ombe imetungwa shindano. Hiyo ng'ombe haikuangi na ndume. Even the eggs, mayai tumekula. Kuna kuku ingine kazi yao ni kutaka tu, hawajui kitu kingine ni kutaka kila siku. Ng'ombe moja ina produce maziwa 20 liters. Ng'ombe moja. Inadungwa shindano, inapatiwa grass fed by fertilizer. By the time you have got that milk on your table is full of chemicals. Health and wellness is personal responsibility. Family responsibility. I know those who have got big men and big women, they don't want to listen to you at about diet. Don't worry, even mine. I'm a doctor, they don't listen to me. Doctor, Daddy is schooling. You know, when I came from US, when I was trained about diet, nilisema tupike kidheri kwa nyumba. Tupike nini? And then they complained, Daddy, mdomo inachoka kabla hatuja mdomo inachoka kabla hatuja shiba. Manake they are not used to eating these very hard things. It's better to teach yourself. I know most of the guys here, you are okay with the kidheri. Keep on and increase. If you're eating once in a week, make it 3 or 4 times in a week kidheri. Okay? Tafuta karai, ndio karai, makaa ya kupika kidheri. Gas inakuwa na shida na stima na kidheri. Tuko pamoja? And when you go back to your families and also to your church, just tell them there's a doctor who told us what we are doing is wrong. Now don't be worried. Give that person the number. If he does not believe in you, mpatie namba yangu. Anipikie simu ndio nimweleze. NHIF. Mimi niko na NHIF. NHIF kwa maneno yake. Does it screen cancer? No. Does it screen diabetes? No. Does it pay for the drugs for diabetes? No. Does this pay the drugs for the hypertension? No. It used to do before. For cancer, it pays half of it. Treatment for cancer. Nowadays, we are better off. Because when you've got cancer, NHIF can pay you something. But before you reach there, umetumia pesa. Insurance. I know most of you are insured. If you are insured, read the small print. The insurance. Does it screen for cancer? Does insurance cover screen for cancer? It's good when your insurance cancer screens for cancer, go to be screened. Because insurance, I know there are people for insurance here. Insurance ni nini? Ni patapotea. Mwaka ikisha, hiyo pesa imepotea. If you are not sick, hiyo imepotea. Na usipolipa next month, next year, huwezi kuambia siku tupia ya makriki hiyo ingine. It's good to check your insurance. Health and wellness is your personal responsibility. Personal responsibility for all of us. These are the tests we can be able to do. Blood pressure, very important. Blood sugar, very important. PSA for men. Very simple test. You can be done here today, not yesterday. Today. And H. pylori, if you got H. pylori, please be checked and be treated until that H. pylori goes. Because if it does not go, you'll have cancer with you. Anybody with a question, nimemaliza na siongei. If you don't ask me a question, I will not talk. Or questions? Oh, there can see a few questions here. Kwanza tunaanza.
Write them down. Yes, so I will also use the same method. We will have 3 here, 3 this sides. So let's start from this side. Yes. Help me with the mic. Okay. Come forward, and you mzee na pastor. Come forward because the mic are very few, so you'll use the same mic.
Yes, I just have 2 questions. Ya kwanza ni kuna vaccine yote ya cancer? Because kuna vaccine ambayo watoto wanapewa kwa shule these days, wasichana mostly. So I just wanted to confirm kama iko. Na pia nowadays kuna ukora mingi sana. So wanaweza jua aje kwamba hii food supplements yenye nauziwa is the right one.
Yeah, daktari
Asante sana kwa mafundisho mema. Najua kwamba tumeguzwa. Lakini lazima turudi kwa debe. Okay, now my question is, do we have any relationship between GMOs and cancer? Do you have any relationship between GMOs and cancer? Because you're a researcher, you have done a lot of work on that. Just to try to explain to us if there's anything, because we have, you talked of information and misunderstanding. Truth. Thank you.
Lolo pito. Maana nyingi zinafunjika na hiyo shida. Na ulisungumzia, lakini hukutuambia what are the causes of lolipito and what is the treatment of the same.
Yes, this side, I need 3. Yes, come forward. You've already come. From this side. I wanted 3. Yeah. I only need 3. Then you come. Come. Let him finish enough and then you do.
Okay. My first question. As I'm going home, tumbo yangu inatetemeka. Daktari hujatuambia ni chakula gani tukule, tusikule. Umesema tu papai na avocado. Afadhali ufafanue ni chakula gani. Number 2, prostate cancer. As men, we were taught in the morning we should practice every day. You understand that? Can it prevent cancer? Sex every day?
Thank you very much. Swali langu kwa daktari ni hili. What causes blood cancer inaitwa leukemia? And is it true that mtu anaweza ipata tu akiwa mkubwa ama inaanza from childhood? Because I lost a friend last year and maybe it was late, but haikuchukua even since the time alikuwa aware, it didn't take him a year na akawa ameenda. Then second question on mambo ya chakula, ulisema when you are eating maybe past I didn't get it well, sijui pasambi usiku, na tuseme maybe you are fasting, so energy ilikuwa imeenda chini, so what should we do in that case? Asante.
Thank you, Dr. Mtuma. I'm privileged. You have lectured so many things concerning men and health issues and wellness. Now, I'm very much concerned about bananas. I come from the areas where we grow a lot of bananas. You have told us consuming bananas, it has repercussions. Now, we grow bananas, and why do we grow them? Can we classify, if it's not a fruit, where does it belong? And I have already consumed a lot of bananas. What can I do about it?
Daktari, in your introductory part, you talked of diet, you talked of things like thyme, carrots, mawiki, ginger, saumu, and hoho. I have a history of PUD. And just recently, I discovered that if I take raw ginger and saumu, it's good for my stomach. But I was in a particular discussion where somebody discouraged me that if you take a lot of ginger, especially every day, it causes blood thinning, hence an avenue for other diseases. Is it true? Please clarify.
Right, very good questions. First, that's my number. You can take it. I've got a card, but I'll give people about 65 years. If you are below 50 years, 65 years, ngangana na hali yako. You can ring me anytime. Just when you ring me, don't tell me your name. Just say Quakers. Tutaconnect haraka. Najua huyu mtu anajua. Okay? Ukisema unaitwa Dominic, itafikiri huyo ajui, lakini ukisema Quakers, tutakuwa pamoja. Sana sana ukiona bibi yako na shida, ukimwambia mumpigie simu niongee na yeye. Consultation for free. That's my number, that's my email. Now, vaccine. There's vaccine. You have finished writing? Anybody who's writing the number up to this time? Huh? Hello? You can see it? Oh, my number is 0722 801 299. 0722 801 299. Hiyo ni better option. Ile ingine ambao iko cheaper, ile ingine 0734 801 299. It is the same. Okay? Vaccine for cancer, it is there. Vaccine for cancer is there, and I want to go direct to that slide now. I'll reach there within a minute, and then the vaccine for cancer, where is it? Right. Ile vaccine inapatewa wasichana, girls. Human papilloma virus, HPV, is a risk factor for cancer of the cervix. That's what causes cancer of the cervix in women. And that's why we are giving vaccine for human papilloma virus for all the girls in primary school. It is important to be given to all women until the age of 55 years because the virus is 95% carrier rate of all women who are sexually active. Human papilloma virus, it is normally transmitted during sex. And 95% of people have it. Women have, when they've got human papilloma virus, it will cause cancer of the cervix. Human papilloma virus causes cancer of the penis in men. Cancer of the penis in men is very rare. That's why we don't advocate vaccination of boys. We expect when we vaccinate girls, we vaccinate boys passively. Second, hepatitis B virus, cause of cancer of the liver. That's why it's being given as immunization nowadays. Cancer of the liver, it will be very rare in Kenya in the young age because they are given hepatitis B virus. H. pylori, no vaccine. Treatment only. HIV, no vaccine. Vaccine for cancer nowadays are only 2. Now, the other question was on good supplements. Supplements, I normally comment from 2 or 3 companies. That one, I'll not say which one they are because I'll be advertising them. But it's better to say. Because me personally, I prescribe to my patients. Like the one which I normally sell now is BF Suma. That's one I normally recommend to every patient. To sell this supplement, you don't need to be a doctor because they are food and you don't need to be a doctor. Most of the people, not most, all the people who sell those supplements have never been to medical school or they have never done anything, but you just know how they work. To give you the supplement, I don't need to see you. Remember, to give you the drugs or poisons, I have to see you in face and I have to check blood to know how you are doing. To give these supplements, just tell me what problem you have and I'll sell the supplement where you are and you take them. The only time you come to see me is when you take them and they don't work. In case you're having arthritis and I give you supplement, you come to see me when they don't work. First, there is no treatment for arthritis. Arthritis, no treatment in medicine, except to remove the bone and put a metal. But with a supplement, if you take them for 6 months, I normally tell them, you take them for 6 months, your arthritis, don't go, come to me, I'll refund your money. I'm the consultant of that company, BF Suma, and I've done, there's a lot of research. These products, there's a lot of research done of them. And that's why when I'm talking about them, I've got confidence because I know what they do. I've given to my patients and I've seen something close to a miracle. A patient who I didn't expect to be alive. He takes these funny things, which I was not taught in school, and he survives even with cancer. The other question is about GMO. This one, I can't talk about it. I've said there are some chicken, kazi yao, wakiamuka ni kutaka mayai na wataki njogoo. Hiyo ni nini? GMO. Kuna ng'ombe ambao ina produce milk 20 liters in a day. Hiyo ni nini? GMO. If you go and milk that cow of yours, ina produce a cup moja. If you milk it more, it'll kick the cup and throw it away. Hiyo ndio ng'ombe ile ya kawaida. Hii ingine ni GMO, imetoka wapi? Na saa ingine haitaki ndume, inazaa. Na hiyo ng'ombe kazi yake ni kuproduce milk kila wakati. That's a GMO. Tomatoes, name them. You know, people talk about GMOs, they think very far. We are already in GMO world. No exception at all. And that's why cancer is very common. I don't want to talk about chemicals because it's a bit depressing to talk about it. Chemicals, I talk about them. Low libido. Low libido is mainly, it has got so many causes. And it's becoming common because of eating the food I've talked about. When men eat a lot of meat, especially when men eat this chicken, you know this chicken which grows 45 days, ikipita inakufa. Inaitwaje? I know there are farmers here. Me, I'm a farmer. That one is the hormones in that whatever is worst. That's why most men have got low libido because of low testosterone. Low testosterone. Testosterone comes from testes. That's why it's called testosterone. Testosterone is manufactured from fat, from cholesterol, from fat. Na siku hizi tukula nyama ya mbuzi nyingi, tunakuwa na testosterone, tunakuwa na cholesterol sio mzuri, na our testosterone is not made well. Most men have got low testosterone for them. So when you've got low testosterone, you have got issues of erection. And most men actually don't erect at all nowadays. Or the erection comes and goes very fast. It has ipembelezo usiku mzima, and that's not supposed to be done. Men are supposed to be electricity. Ukifanya namna hii, inafanya mara moja. Hii ya kupembeleza kama njiko ya makaa, hiyo sio mwanaume. Mwanaume ni ka na anawaka. Sawa sawa. Hii ya kupembeleza, hiyo ni jiko ya makaa na hiyo sio mwanaume. It's because of low testosterone, because of eating a lot of meat in men nowadays and eating a lot of fat, which is not very good. And that's why people with high levels of cholesterol, like when you've got hypertension, you've got high level of cholesterol. When you have got diabetes, you've got all high level of cholesterol, and the cholesterol blocks the vessels. The cholesterol blocks the vessels. When it blocks the vessels, mwanaume anasimama ni kwa sababu damu inakuja. Ni damu inafanya usimame. Na ikiwa damu haifiki hapo because of the vessels are constricted, huwezi simama. That's the reason, because inasimama kwa sababu ya blood inakuja huko. Is full of blood. Na ndio maana mwanaume akitumia ile kitu inaitwa Viagra. Ukiwa umetumia na uko hai, thank God. Najua hapa ni wanaume na wanaume ni wanaume na najua wanaume. Mimi ni daktari. Najua na wananiambianga, daktari nimetumia hii kitu na nilikuwa karibu kwenda. Nimwambia siku nyingine utaenda. Viagra kills real dead. Viagra blue pill. Wewe ukiwa umetumia na uko hai, sawa. Vile Viagra inafanya, inafuruta damu inapeleka huko unasimama. Lakini haijui kurudisha. Ukisimama umesimama. Alafu vile imeconstrict, imefuta hiyo damu, inapeleka the same damu in the heart. Kwa the heart. Na heart inafura. Kama hiyo kitu imesimama namna hii, iko stiff, iko mzuri, na heart imesimama na iko stiff namna hii, I pump blood. Si ulikuwa unataka kitu isimame namna hii? Na ati imesimama namna hii. Imesimama namna hii. Ati imesimama namna hii. Na ikisimama hakuna why. Ati ikisimama namna hii hakuna why. I've got so many people, so many senior people, even presidents. Not even a simple man, a president. Manake, man is erection. Without erection, man has no value. Exactly. Hey, ameongeza. Completely. The ego of a man, ukisimama ndio unasikia wewe mwanaume. Ukiamka asubuhi na hiyo kitu haisimami, na kesho haisimami, na ikiona mwanamke haisimami, sasa unafikiria. Na shida ni ukiwa na mwanamke nyumbani na usimami. Kwanza, koro every day unaenda nje. Kwa nini hii kitu yako isimami? Si kuna simama, unapatia watu wengine nje. Pastors, you know that. So many weddings are broken down. Remember, the woman left their fathers and their mothers to come to you. Alafu apati, na ulinua na mbuzi na ng'ombe, alafu apati, na anajua lazima kuwa unaenda mahali ingine. Tuko pamoja. Na men, we are always blamed of going out. All the time. Uko na bibi mwingine mahali ingine, umwambie hata Abraham alikuwa na bibi mwingine. Hata David alikuwa na bibi mwingine. Solomon akaharibu mambo. Tuko pamoja. Men of Christ, one wife. Wale wengine wachana na wao. Tuko pamoja. One wife. Faithfulness, fidelity is very important in church men. Faithfulness very important. I don't give my good supplement to men. You know me, I'm a strict Christian. I'm not a Christian, I'm a Catholic. I don't give men nakuuliza wewe unataka kutumia nini? Ukiniambia ni yule kale kanaitwaje? Side what? Chick ndio kana shida. Zizi bibi ako 50, ako 60. Yeye ana shida. Kake kengine kako na shida. I don't give you. So kwa pamoja. I give for men who are married. In marriage, if the woman is not be satisfied, I'll give you the product and I never go wrong. When I give you the product, sometimes, in fact, I prefer I give the product for you as a man and also I give the wife the product. Kuna zile zake. Ndio mkue unacheza match moja. Mtu asikue anacheza number 2, mwingine ako number 10. Tuko pamoja? So that you are the same number. That's very important. And that's why I normally give for those who are married in marriage and in church. In Catholic, we call it sacraments. Right, food. The food which you should eat is natural food. Ugali, brown ugali. Ama ile ya kushaga, ile ya posho meal. Ile ya mahindi yote, imeshangwa yote. That's very good. Have you known? Ukishanga mahindi yote na uweke hiyo unga kwa wiki 2 itaharibika. Kwa sababu gani? Ukifanya ile ya jogoo ama ile ingine ununua kwa duka, ukiweka hiyo unga mwaka mzima itakuwa iko sawa. Because it has no nutrients at all. Ukipika ugali na hiyo unga inakuwa ngumu kama mawe. Chapati ukiacha inakauka kama hakuna kitu inakula. Kwa sababu it has no nutrients at all. Food, natural food supplements. When you are eating, make sure that a half of your plate, it is greens. A half of your plate, it is greens. A half of your plate. Unaona greens, uoni ugali. sima. Saa ingine unawekewa sima mingi alafu boka kidogo, alafu unakula kipande mpaka umalize. Unataka ukule greens more than carbohydrates. Carbohydrates is actually the originator of all the diseases. Night, why eat at night? It is because in the morning we break the fast. That's why God break fast. You break the fast. So you are supposed, I normally tell people that take 16 hours without eating. It is called intermittent fasting. 16 hours without eating. It's important to eat in the morning and lunchtime. Jioni is not important to eat, but we have changed. Of course, when you're not eating the whole day, you cannot say that I'll not eat at night. And when you eat at night, eat very little food. And eat fruits and vegetables, a lot of it. When you eat ugali, fanya namna hii. Fanya namna hii ngumi. Namna hii. Usikule ugali iko kubwa kuliko hiyo ngumi. Tuko pamoja. Be measuring like that. Usikule ugali prostate and the sex. You know what a pathologist is? I've said I'm a pathologist. I know people know pathologists are people dealing with the dead. Yeah, I'm a pathologist myself. Yes. Pathologist is a doctor who knows everything and does everything, but 1 minute late. He tells you are dead when you're already dead. Tuko pamoja. But me, I've changed. My knowledge, I normally talk with the dead to save the living. When I talk, people are dying because of this. I've seen. And I was the chief government pathologist in 1997-98. 97-98, I was the chief government pathologist. So there's nothing, najua. I was saying I'm giving back to community, but the community has given me nothing. But God has given me something. Okay? Right. Where are we now? Prostate and sex. Prostate and sex. Prostate and sex. Sikiza hapa. The more sex you have, the more the chance you are to develop cancer of the prostate. The more sex you have, the more the chance you have cancer of the prostate. The more testosterone you have, the other the chance of having cancer of the prostate. Cancer of the prostate is common in blacks more than the whites because blacks have got more testosterone. That's why they produce a lot of children, 10 of them, okay? 1 man, 10 official, 5 unofficial. Testosterone. To treat cancer of the prostate in men, we remove the testes. We remove the testosterone. Okay, this is not good. Once you have cancer of the prostate and we treat you, wewe unamalizika na unaenda. Uwezi mama. That's why many refuse the treatment of cancer of the prostate. Wanama wanasema afadhali nikufe na hiyo prostate. Na ukisema na hiyo testosterone, na ukisema na hiyo unakufa. Prostate cancer kills men dead. I've lost my cousins, 3 of them or 4. Niliwaambia watritiwe, wakasema daktari siwezi. Hawako. If you have got cancer of the prostate, just agree the man would to go. Just agree. The higher the testosterone, the higher the chance of having cancer of the prostate. Communities where they are very active in bed, the same community, we have high rates of cancer of the prostate. I'm talking as a population level, not individual level. Prostate, and usiambiwe na mundu ingine, na if somebody tells you, ring me. Leukemia can affect young age, old age. Bananas. Banana is not a fruit. Banana is not a fruit. Banana is not a fruit. Banana is carbohydrates. Banana and rice are the same. Banana and chapati are the same. When you eat rice, alafu unakula fruit as banana, you are wasting your time. No fruit you have eaten. Even when you go to biology class, I know there's a biology teacher here, you can find a Benedict solution in a turn blue because banana is a carbohydrate. It's not a fruit. Tuko pamoja. Peptic ulcer and ginger. Peptic ulcer with onions. Peptic ulcer with tomatoes. Peptic ulcer, it is, why do we have peptic ulcer? Kidonda ya tumbo. Kidonda ya tumbo. Why do we have it? Why do we have it? Anything which is good, anything which has got taste, it has acidity. Anything which is sweet, has acidity. The stomach is acidic because it digests the food using the acid. So the acid is very important for stomach. Ikiwa juu, when the acid is high, it causes erosion of the wall of the stomach. Erosion. Erosion ikiendelea mingi sana, when the acid is high, it creates a wound. When the wound is there, it is painful because the acid in the stomach burns the wound. And that wound, it can convert to cancer. So anything sweet, pilipili, onion, kachumbali, all that, it has a lot of acid. It makes food to be digested well. That's why when we eat pilipili, the digestion is better because the acidity is high. But that acid can be a disease when it's normally very, very high. Pastor, sasa sitaongea tena. Wale wako na maswali, uko na namba yangu. Consultation is free. Sina haraka. Na hatuna haraka until you can go where we are. You sell the products there. With the every product is there. You don't need to go and come tomorrow. You don't need to come tomorrow. The products are there. The tests are there. You'll be done. The products are there. In case you don't have money, you know, money is the only thing when you ask it, you are told it's not there. Have you known that? Mtu anasema kila wakati natafuta pesa. Kuna mtu amekwambia niko na pesa except when drunk. Kwa hivyo ukiwa una pesa leo, don't worry. Just ring us. We will bring the product where you are. Because we normally take the product to so many people, and to give you the product, I don't need to see you as a doctor. No. Because they are foods. I don't need to see you to give you food. But when you've got diabetes, to write you the drunk, you have to come and see me. Ndio nikuone vile uko, nikupime kwanza. For our natural food products, you don't need to see a doctor. I don't need to take blood. I just give you and they do the work. Memaliza.
Can we appreciate Daktari, please? Thank you, Daktari. Thank you so much. Without any much ado, let us pray, and then I will also invite our president to continue from there. Father, we honor you. We thank you because we began with you. And Lord, you have enabled the doctor to let us know what we should have known. And we want to thank each and every person that has heard this. May you help us, Lord, even as we are going out in our various places. May we use this knowledge for our own betterment and for others. For it is in Jesus' name we do pray. Amen. Thank you. President.
Let's appreciate our presider of the speaker. And also let us appreciate our doctor. He has done a good job. Thank you, Daktari, for taking us through that. Without taking much time, I want to invite just 1 or 2 minutes to Siondoke. Invite the secretary to say a word, then invites the one who is going to close. Otherwise, I appreciate you for coming. Muendelee kuja. We are going to send you an evaluation form on your WhatsApp. where you are going to fill in and give us feedback of this seminar with the other seminars which have been done in other QCCs. So when you see it, please fill it and then you send it back. Thank you.
Yeah, once again, habari zenu. Yeah, tusichoke, tumalize sisi wote pamoja. Tunamaliza tu sasa hivi. Nataka niseme ya kwamba congratulations LNGCC, QCC I mean, for a successful seminar. Mungu atubariki sana wale ambao walipanga. Mungu atuongoze wakati mwingine tukue na activity kama hii. I want to say this. This falls under the second quarter activities. That is, in second quarter we began with Mombasa mission on 12th this month. We came to Nairobi funds drive. That was done on 19th. And now 25th of May, we are gathered here. Inashukuru sana, Mungu ni mwema. Hii seminar, we call it a success. Ninataka niguzie kitu kingine ambacho, ama activity ingine ambayo itafall under the second quarter is Quakermen Day. Quakermen Day will be celebrated in June 30th. Hii inalete wanaume wote pamoja katika worship na itaongozwa katika QCC zetu the same way it's been done today. Tumekuwa na wenzetu kule Nakuru. I told you in the morning, our representative there was Kadiagala in Mombasa.